Depression is a complex and often misunderstood mental health experience that can affect people in different ways. While some individuals experience classic symptoms such as low mood, lack of energy, and difficulty sleeping, others may have high functioning depression. High functioning depression is a little bit harder to detect. This type of depression is characterized by the ability to carry out daily tasks and responsibilities despite feeling a persistent sense of sadness or emptiness. In this video, we will explore the hidden signs of high functioning depression. So, what is high functioning depression? High functioning depression is a type of depression that can be difficult to identify because individuals are able to still maintain their normal daily activities, such as work or socializing, even despite feeling persistently down or empty. This can cause individuals to underestimate their symptoms and even dismiss them as stress or fatigue. So, some common signs of high functioning depression include difficulty experiencing joy or pleasure in activities that were once enjoyable, persistent feelings of sadness or emptiness that doesn't go away, irritability, anger, or frustration that is disproportionate to a situation, increased or decreased appetite with associated weight gain or weight loss, insomnia or oversleeping, difficulty concentrating or making decisions, chronic fatigue or low energy levels. Or you can have physical symptoms such as headaches or digestive issues. While some signs of high functioning depression are more obvious, others can be more subtle and easily overlooked. Here are some of the more hidden signs of high functioning depression. One could be perfectionism. Individuals with high functioning depression may have a strong desire to be perfect in their work or relationships. They may feel like they have to work harder than others to achieve the same results, leading to increased stress and anxiety. The next one is overachieving. Similar to perfectionism, individuals with high functioning depression may feel the need to constantly achieve more and set high standards for themselves. This can lead to burnout and exhaustion. Self criticism is another. Individuals with high functioning depression may have a tendency to be overly critical of themselves, often with a harsh internal monologue. This can lead to feelings of shame or guilt, which can contribute to depression symptoms also. Another is withdrawal. While high functioning depression may not always result in social withdrawal, individuals may still feel like they are going through the motions and not fully present in the social situations or interactions. They may also avoid activities they once enjoyed or turn down invitations due to the lack of energy or interest. The next is emotional numbness. Individuals with high functioning depression may feel like they are going through the motions of life. They're just on autopilot without any emotional depth. They may not experience extreme highs or lows, but rather a persistent sense of flatness or just emptiness. If you suspect that you might be experiencing high functioning depression, it's important to identify and address the underlying causes of your symptoms. You could do that through multiple ways. You can read multiple books, you can tune into multiple podcasts and videos on YouTube. If you want to go the professional route, you can go to a therapist, a counselor, a coach, maybe even an alternative healer, depending on what you are into and what is acceptable to you and what you will feel comfortable with. I know that through certain workplaces and through the NHS, you should have access to talk therapies. So that might be an avenue that you can explore. So, some other tips that you can use for addressing high functioning depression is practicing mindfulness. Mindfulness practices such as meditation, yoga, or deep breathing exercises can help you stay present in the moment and reduce stress and anxiety. The next is to try and set realistic expectations. Instead of striving for perfection or overachieving, try setting realistic goals and expectations for yourself. Remember that it's okay to ask for help and to take a break when you need it. Practice self compassion. Self compassion is a crucial component in managing high functioning depression. It involves treating yourself with the same kindness and understanding that you would offer to a friend who is struggling. It means acknowledging that you are going through a difficult time right now and responding with empathy rather than criticism or judgment. One way to practice self compassion is to start with self talk. Notice when you are being hard on yourself and try to reframe those negative thoughts with positive and compassionate ones. For example, instead of telling yourself, you're so lazy or you're so unmotivated, you can say, I'm struggling right now, and that's okay. It's understandable to feel this way given everything that's going on in my life. But I'm in the process of making things better. Another way to practice self compassion is to engage in self care activities that nourish your mind, body, and soul. This can include things like getting enough sleep, eating healthy anti inflammatory foods, exercising regularly, spending time in nature, as I said before, mindfulness or meditation, and doing things that bring you joy, and also carving out space for relaxation, being intentional about relaxing. It is also important to set realistic expectations for yourself and to not push yourself too hard. High functioning depression can make it difficult to gauge what is realistic and achievable, but by setting small goals and taking things one step at a time can be quite helpful. Be gentle with yourself and remember that progress is a process. Self compassion can be challenging for some people, especially if they have a history of being hard on themselves or are used to putting others' needs before their own. But with practice and patience, it is possible to cultivate a more self compassionate mindset. Learn to be kinder and more understanding towards yourself and start utilizing the skills that you feel comfortable with to manage these symptoms. Remember, self compassion is not about making excuses for yourself or avoiding responsibility, not taking accountability. It's about acknowledging your struggles and treating yourself with the same care and respect that you would offer to others. By practicing self compassion, you can build a stronger sense of self worth, improve your mental health, and ultimately lead a more fulfilling life. High functioning depression can also lead to physical symptoms, including headaches, stomach problems, and fatigue. The physical symptoms can be attributed to stress or other physical health issues, leading to misdiagnosis and inadequate treatment. One of the most common misconceptions about high functioning depression is that the person is simply lazy or unmotivated, when in reality, they may be experiencing a lack of energy and motivation due to the depressive symptoms, but are still able to push through and complete certain other tasks. It's important to recognize the signs of high functioning depression and to seek help where needed. Therapy and or lifestyle changes can be very effective in treating depression. Remember, depression is real and it shouldn't be something that is trivialized. There's also no shame in seeking out videos like this or support in other ways, such as therapy. But I want you to know that it is possible to overcome high functioning depression and to live a very fulfilling life. And remember, you are powerful beyond measure. Keep showing up for yourself, and I'll be here to cheer you on. Remember to like, comment, and subscribe, and I will see you in the next video.